Sarkis, one of the questions every student wants to know is how long will this process take? So in other words, with your structured learning, with your blended modules, how long is this mini residency?
Well, Derek, this is a diploma in prosthodontics and dentofacial aesthetics. So having diploma in prosthodontics and dentofacial aesthetics, it's a very unique course. We're the first course of its kind in the world. And so I try to condense this course within 12 modules over 2 years. So a student comes in every 2 months and they have 20 hours of face-to-face learning. But in between those 2 months, they have 80 hours of assignments, okay? 20 hours of Zoom, case discussions, so there's a lot of work. We also have certificate in prosthodontics and dentofacial aesthetics, and that's 12 months program, which students can initially complete and finish, and from then they can move on to the next one.
Try before you buy.
Absolutely.
They can do the 1 year certificate. If they like it, they want to go further. That's very good, because otherwise for young graduates, it's a big commitment sometimes, financially, time.
It is. But I believe that once they do the certificate course, they'll be able to go to the next one, because during that course while they're training, they will improve their financial outcome in their clinical settings, because they'll be able to diagnose, treat more cases, become more confident.
Yeah.
So I have no doubt that go to a diploma immediately.
Yeah. And we find in the orthodontic module, it takes at least 2 years to finish a case. So if you're doing short weekend courses, what happens when you're actually treating a patient? Who's helping you supervise? So the great thing about your program, they can keep bringing their cases on a continuing education platform with the same instructor for a period of time that would allow them to do some more complex work.
Absolutely. We encourage them to have at least 5 cases from start to finish. Mm-hmm. So let's say if you have a number of students times 5,
yeah,
everyone's seeing each other's cases.
Yes.
So that actually covers broad base of prosthodontics,
yeah,
and the dentofacial aesthetics. I mean, we all know that this is how we teach nowadays. You learn from each other's cases.
Yeah.
It's very important. I mean, I diagnose, help the clinician. There'll be other specialists on board, such as yourself, who will say, well, I think the best treatment here to do this, and to do that. I mean, how often do we sit down, treatment plan for our patients? We have joint patient consultation, where patient can really see you got specialists on board who really care for them. We want our general dentists on board to think and practice like specialists. And that's important.